Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers. And the question last week was, my dad is in ICU on a ventilator with tracheostomy. Is it true that my dad can go home with services like intensive care at home? You can check out last week's question by clicking on the link below this video. In today's episode, I want to answer a question that we get so frequently that it's really time to look into this in more depth. It's actually a case study that is a real case study from a client. However, the question is a general that I really want to answer also on a more general level. So today's question is ICU versus intensive care at home versus LTAC. And just to clarify what LTAC stands for long-term acute care facility, and I'll break this down in more detail throughout this video. So let me break this down today for you so that you have all the answers and that you can make informed decisions, get peace of mind, control, power, and influence when it comes to these very important and also often life or death decisions that you need to make when your loved one is in ICU with ventilation and tracheostomy. So let me read out this email from Zia, and Zia writes, my 67-year-old dad was sent to the emergency department after being ill for about 12 days at home. We were told on the phone, due to no hospital visitation regulations at the moment because of the COVID, several hours later that he was severely dehydrated and in acute renal failure. He was admitted to the ICU and intubated, and 2 more COVID tests were performed, all coming back negative, even though we told them the first test was negative. Honestly, I think they were treating him as a COVID patient initially, which is why he was intubated. They claim to, quote unquote, protect his airway. Several days later, they recognized a clot on his leg and he had a DVT, which became a PE. PE stands for pulmonary embolism and DVT stands for deep vein thrombosis. Something he has had in another state 8 years ago, so it actually wasn't in his medical records. Anyway, currently he has a tracheostomy and all the hospital wants to do is transfer him to an LTAC facility. Again, LTAC stands for long-term acute care. They called this morning saying they had found a bed for him in an LTAC facility and they need consent from us as a family. We, as a family, did not give consent, and I came across your websites, Intensive Care Hotline and Intensive Care at Home, and we'd love to hear your input in regards to weaning him off the ventilator and also options going forward. I have had several discussions and finally we are at the place where he gets taken off the ventilator for a few hours a day, goes on a CPAP mode or room air, and then back on the ventilator to get him to rest. According to the ICU team, we don't want him in an LTAC. I'm concerned about infections and even bed sores and lack of quality care. I would much rather engage a service like intensive care at home. If my dad can't come off the ventilator, I'm really looking forward to your thoughts and advice. Well, thank you so much, Zia, for writing in, and I'm sure I can give you an answer to your question and break down the issue such as ICU versus intensive care at home versus LTAC. So let's look into that. Again, Zia, thanks for writing in, and let's break this down for you today. I am not surprised at all that your dad initially was treated as a COVID patient in the ER or in the emergency department, and then he went into ICU, got intubated to protect his airway. At the moment, my understanding is that in ICU as well as in ED, patients get intubated much quicker than usual because it diminishes the exposure for staff and protect actually the staff when patients are intubated. It sort of gets less droplets into the air that are potentially COVID positive. And when there are droplets in the air, the risk for staff to get infected is very high. And in order for staff to protect themselves, they either have to intubate patients, which I believe is not the right thing to do. The better thing to do is to wear N95 or P2 masks that is protecting staff's airways. So then your dad obviously had to have the tracheostomy. He couldn't come off the ventilator from what you've shared for whatever reason. It sounds to me like the deep vein thrombosis, the DVT, and the PE, the pulmonary embolus, contributed to your dad not coming off the ventilator. It is a shame that it wasn't picked up that he had a PE in the past, because they could have potentially heparinized him early on and potentially prevented the DVT. Heparin is often given in ICU to prevent a deep vein thrombosis and to prevent a pulmonary embolism. In any case, he's now having a tracheostomy, he's now having CPAP trials and room air trials, and it looks like he's slowly moving towards getting off the ventilator. But it also sounds like he's not there yet. And it sounds like the ICU was entertaining the thought of getting him to LTAC as the next step. And obviously you have done your research. You have found that intensive care at home is an option. So let's look at the next steps. First of all, if someone is in ICU and is close to coming off the ventilator and the tracheostomy, they should not be leaving intensive care to begin with. The best place to wean somebody off the ventilator, especially when it's short term, is intensive care. Why do I say that? I say that very confidently because ventilation and tracheostomy is a specialist skill that can only be found in intensive care or with a service like intensive care at home. But I'll come to intensive care at home in more detail in a moment. Let's just keep focusing on ICU for a minute. In ICU, you have intensive care doctors, you have intensive care trained nurses. In the United States and Canada, you've got respiratory therapists as well. In other countries such as Australia or the UK, you don't have respiratory therapists, but you don't really need them because ICU doctors and ICU nurses can manage the weaning process in ICU quite confidently. So in your dad's case, it sounds like he's not too far away from getting off the ventilator. Therefore, he should stay in ICU until he's off the ventilator. End of story, period. So I've seen so many patients in ICU over the years being weaned off the ventilator and the tracheostomy that an LTAC is just bringing patients down, really. And why do I say that? So you go from intensive care, where you have intensive care trained doctors, intensive care trained nurses that go through many years of specialist training that are used to looking after patients on ventilation with a breathing tube or with a tracheostomy. And that takes years of training and exposure to that specialist skill. So when patients go to LTAC, the most important reason patients go to LTAC is, number one, ICU needs to empty their beds because ICU beds are in high demand. That is number one. Number two, LTACs are purely designed to save money for the funding bodies, for the insurances. And when patients go to LTAC, it's not based on clinical needs. It's simply based because ICUs need to empty the ICU beds, and because they are in high demand. And then when patients do go to LTAC, they often bounce back to intensive care or to ICU simply because they're not ready to go to LTAC and they don't have the skills and expertise to look after someone coming from ICU. So why do they bounce back to ICU? Well, again, number one, because they're often not ready. They get pushed out just for financial reasons, not for clinical reasons. Number two, when patients go to LTAC, there is no ICU trained doctors, ICU trained nurses available. LTACs are often staffed by general registered nurses. They have no ventilation and no tracheostomy training. So if you actually look at some of the reviews, some of the online reviews for LTACs, they're shocking reviews. They're negative reviews because you're simply going from an environment, intensive care, where there's highly trained, highly specialized ICU doctors, ICU nurses, to an environment where you don't have highly trained doctors and highly trained ICU nurses. You often have one doctor for 30 patients. You often have one non-ICU registered nurse for 5 patients. So there is no quality care in LTAC. Outcomes in LTAC are pretty poor. Again, you can verify that online on the reviews for LTACs. And therefore, patients then deteriorate and go back to ICU, and not necessarily to the ICU where they came from. LTACs are often 1 hour, 2 hours away from the original ICU where patients had been admitted to. So if then patients bounce back to ICU, they often end up in another ICU. So picture that. Picture that. You're going from ICU when you're critically ill to LTAC, and then you're bouncing back into ICU, into an ICU where you haven't been before. So when you're critically ill, you do not want to change hospitals all the time. That is detrimental to consistency of care. When someone is critically ill, they need consistency of care and not being moved around from hospital to hospital. That is stupid. That is absolutely stupid, and it goes against any common sense. Again, what is important when patients are critically ill? It is important to focus on consistency of care. A patient that's critically ill is already outside of their comfort zone. Their families are already outside of the comfort zone, and they don't need the disruption of a care episode during a critical illness by going to LTAC. So what that means is when patients go to LTAC, they often go to LTAC, as I mentioned, far away from their home. They often go away to LTACs 2 hours away from their home, and families can't really visit them. Now, when patients are critically ill, they need to be around their families and not far away. So those are the main reasons why someone should stay in ICU after a tracheostomy and mechanical ventilation. Now, if a patient can't be weaned off the ventilator and the tracheostomy, the only genuine alternative for that is intensive care at home. That is the only genuine alternative, because basically intensive care at home, you can continue the care episode from intensive care in a home care environment. You can continue that at home with 24-hour intensive care nurses and having the intensive care doctor. That is the only genuine alternative. Also, on an economic level, it cuts the cost of an ICU bed by 50%, and patients and families are where they should be. So this is a win-win situation. Intensive care at home is also much more patient and family friendly in a holistic care environment. And it's not 2 hours away from the original ICU like most LTACs are. So again, intensive care at home is a win-win situation, and it cuts the cost of an ICU bed by 50%. And it provides the same level of quality care just at home. Patients can be weaned off the ventilator at home. They're close to an ICU where they really need to be. But I mean, the goal of intensive care at home is certainly to keep patients at home predictably and get them their care episodes at home, including weaning mechanical ventilation. So that is really the difference between ICU, LTAC and intensive care at home. To sum it up again, ICU definitely for the short term, and if somebody can't be weaned off the ventilator, ventilation free and tracheostomy free, they should do that in ICU. If ventilation and tracheostomy is needed in the long run, then definitely intensive care at home. Whereas LTAC really is a no-go on all levels, and you can see that when you Google online reviews for LTACs, they are actually shocking. So I hope that answers the question. For more information about intensive care at home, check out intensivecareathome.com. Thank you so much for tuning into this week's Your Questions Answered episode. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, have peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? you will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what is really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of our website. Also, have a look at our ebook section, and you can get one-on-one consulting and advocacy with me over the phone, via Skype, via Zoom and via email by clicking on the relevant tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.